Hey guys, my name is Matt Elmore. I'm the Executive Director for Alzheimer's Arkansas, and we're excited to present this online Lunch and Learn today. We have here with us Dr. Sydney Crawley, PhD, and I will let her later, before she starts presenting, explain all of her background and credentials and studies that she's done, because I definitely don't want to mess any of that up. But today we're going to talk about COVID-19. Kind of give some basic information and background about the virus itself, and then how that might affect or relate to people with dementia, or those of you out there who are caring for someone with dementia, including Alzheimer's disease. Before we get started, just want to cover a couple little announcements for our organization. We have also decided to cancel all of our in-person lunch and learns for the month of May. We will continue doing these weekly online lunch and learns, and we do have each of those dates and topics and speakers posted on our website now. So you can visit that, alzark.org, if you want to see that full lineup. We're also canceling all of our in-person support groups for May as well. So make sure you visit our Facebook page to hear about everything that we're doing. Right now for online education and support, we're still offering our grants for caregivers out there. We have all that information still on the website. And of course, you can still always call us for any information or resources over the phone as well. We do have an online support group, if that's something that you would be interested in. It's a group on our Facebook page. We'd love to have you, so you can network with other caregivers around the state to share resources and tips and tricks and information. We also want to make sure everyone knows about our COVID-19 response grant. So if you are a caregiver in the state of Arkansas and your employment or your income has been impacted in any way because of COVID-19, we have a one-time $100 grant. It's really easy to apply for. You can use that for utilities, groceries, respite care, literally anything that you can use it for that would make that situation a little bit happier or safer or more convenient for you caring for your loved one. We don't care, just use it for that. And that's for a caregiver of someone with any chronic illness that requires a caregiver. So not just Alzheimer's or another type of dementia, but any chronic illness. If the patient lives in Arkansas and they're 60 years of age or older, check that out, give us a call. We want you to know that we have funds available to help you out, and we want to make sure you can get it. All right, so at this time, Sydney, I'll turn it over to you. Sydney and I have known each other for going on 19 years now, all the way back to middle school. She is, I think, a very intelligent person. I'm excited to hear her present on this today. So Sydney, I'll turn it over to you.
Matt, so actually my first slide has some of my credentials on it, so I will pull that up and talk through that. So as Matt said, my name is Dr. Sydney Crawley. I have a PhD in medical and urban entomology. So entomology is actually the study of insects, but I became interested in that because I'm actually very interested in virology, and insects vector a number of viruses that transmit diseases to people, such as West Nile virus, Zika, chikungunya, dengue. So I've been interested in virology for a very long time, but my degree is technically in entomology. I did teach a microbiology course while I was a PhD student at UK, University of Kentucky, for almost 4 years. So I do have some expertise in microbiology, virology, and just a long-standing interest in this topic. I think Matt can tell you, since he's known me since middle school, when everyone else was reading Harry Potter, I had a lot of books about the Ebola virus, and so I was very popular, needless to say, but I'm very interested in epidemiology. With that, though, I will say I am not a medical doctor. I can't answer any clinical questions, but if you have any scientific questions about the virus or any of the literature that's out there circulating right now, I'm happy to answer questions on that topic. So we'll go ahead and get started. I wanted to give a brief background on what exactly a virus is, which I think makes the rest of the talk a little easier to understand. So viruses are very, very small particles called nanoparticles, and those are particles that measure less than 100 nanometers. So obviously we cannot see them with the naked eye. Requires a very powerful microscope, actually a microscope that's more powerful than what you would use to look at bacteria. Inside, they have genetic material, which is DNA or RNA, which codes all of their genes, a protective coat over that genetic material called a capsid. And the capsid is what tells you, its structure is what dictates how long a virus can survive on a surface. And occasionally, they also have another protective coat called the envelope. The viral envelopes are fatty membranes, and that's why soap, as a side note, works so well to destroy viruses. Due to the properties of soap, they're able to get in between those lipid layers and break them apart. So that's why we recommend hand washing for 20 seconds with SARS-CoV-2. They get this envelope actually from the membranes of cells that they infect. So the membranes, the envelopes around a virus, come from the animals or bacteria that they infect. And the capsid just keeps the DNA or the RNA safe. So if you damage the capsid, you're also going to damage the DNA or RNA of the virus and effectively kill it. So like I said, the capsid is to protect and deliver DNA to host cells during infection. So if you damage the envelope or the capsid, you're in good shape as far as preventing the virus from infecting a host. They are not alive, and they are much smaller than bacteria. And as a side note, antibiotics do not work on viruses. Hopefully everyone's familiar with that, but I just feel the need to say it because I still get that question all the time. So what is SARS-CoV-2? So SARS-CoV-2 is the name of the new coronavirus that causes COVID-19. So that's kind of an important distinction that I wanted to make. So pathogens like SARS-CoV-2 cause diseases like COVID-19. So that's kind of where the two different names come from, and I wanted to make that distinction. SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2. So it's genetically related to the virus that caused SARS in 2002 and 2003, but it's not exactly the same. It is a brand new virus, and it's a new strain that has never been identified before. Often when this happens, it is due to what we call a spillover event. So spillover events occur when a species that's naturally harboring a virus comes into contact with another related animal species, and they share enough in common with their biology that the virus is actually able to kind of jump hosts and infect the new host. So we're thinking, as far as we know right now, information changes daily, that humans at some point came into contact with an animal that was carrying SARS-CoV-2 and it shifted hosts. That's what we think happened. If that changes, I'll be sure to get that information to Matt and he can pass that on. Like I said before, COVID-19 is the disease caused by this virus. It stands for Coronavirus Disease 2019. It does not mean that this is the 19th coronavirus that occurs in people. So there are other coronaviruses that infect humans. Some of them cause pneumonia, some of them cause the common cold, and like I said earlier, one of them causes SARS, but this one is different than all of those viruses. So the family of viruses that a particular pathogen is in does not dictate how virulent it is. So for someone to say SARS-CoV-2 is, in the same family as the common cold, so is it really that bad? Those things aren't related. The common cold, one of the forms of it, is genetically similar to this virus, but how deadly they are, you can't say anything about that based on the family that they're in. So that's important to note as well. Matt wanted me to talk a little bit about the multiple different names that we've seen COVID-19 referred to. So as I said before, COVID-19 is the actual disease caused by infection with SARS-CoV-2. Just because you get infected with a virus does not mean you will actually exhibit any symptoms of disease. In fact, many people that are infected are asymptomatic and never knew that they were carrying the virus in the first place. So in that case, you wouldn't say that that person actually had COVID-19. They didn't exhibit the disease, but they were infected with the virus. So when we name viruses, it's a very difficult process. Scientists have a really great system in place for naming living things. But like I said before, viruses aren't living. And so the system kind of breaks down when we start talking about the taxonomy of viruses. So in the past, to make it easy, viruses were named after the places they were identified. So West Nile virus, near the West Nile, St. Louis encephalitis, the Spanish flu. However, unfortunately, that has created some stigmas that people have found to be very negative. It's kind of like a blame game that we don't want to perpetuate. So an example of that, even as recently as the H1N1 swine flu, that created really devastating impacts for the pork industry. So evidence did not show a link between pork consumption and getting H1N1. But because people called it the swine flu, there was a huge decline in pork sales. So it is really not correct to call SARS-CoV-2 the Chinese virus or the Wuhan virus. It is officially now named SARS-CoV-2. So we use molecular characteristics that I'm not going to go into to name viruses. So characteristics of their DNA and RNA, what kind of capsid do they have? Is the DNA or RNA positive or negative sensed? All things that are kind of, even above my head in some cases. They're named based on those factors. Sometimes they're also named according to the diseases they cause, such as poliovirus or rabies, or where in the body that the virus affects. So it's kind of a mess. Virologists are still working on making the system better, and the names of viruses do change over time. But for right now, the name of this virus is SARS-CoV-2. It's not correct to name it after the place where it originated from. As far as what the symptomology is, I've listed the most common and less common. I will say, since I wrote this talk 2 days ago, the CDC has listed a new list of symptoms that moved, I believe, the loss of taste or smell, sore throat, and headache into more of the most common groups. So fever, a dry cough, being short, having difficulty taking deep breaths, fatigue, having a headache, productive cough, and GI symptoms are some of the symptoms that patients have complained of. However, almost 80% of infections are actually not severe. So moving into those less common symptoms like the productive cough or having GI symptoms, that doesn't typically occur as of yet. We see the most severe cases in patients age 70 and above. And the average amount of days for these symptoms to exhibit is about 3.5. Most people that develop severe symptoms, like needing to be put on a ventilator, have comorbidities, which I'll talk about what those are in just a second. But it's just important to note that, as I said before, you can actually have SARS-CoV-2, you can be infected, and many people have been asymptomatic. So just because you aren't showing symptoms does not necessarily mean that you are virus-free, which is, again, it emphasizes the importance of the quarantining that we're all doing right now. There have also been a lot of articles coming out regarding whether or not SARS-CoV-2 is airborne. So I wanted to touch on that just a little bit and talk about how it's spread. This virus spreads person to person via respiratory droplets when a person coughs or sneezes. Now, a respiratory droplet moving through the air for a short amount of time and landing on someone else, that is not technically being airborne. So they can land in the nose or mouth of people that are nearby, or they may inhale into the lungs. But the spread is most likely, in the case where we're talking about respiratory droplets, when a person is within 6 feet of the other individual. Otherwise, the virus succumbs to gravity, falls on the ground, lands on a surface, and just kind of sits there and eventually is going to break apart and die due to UV exposure, disinfectants, etc. A true airborne virus can remain in the air for multiple meters intact. It will not fall to the ground, and it doesn't desiccate in the air. So the one that I have the arrow pointed to in that chart is the measles virus. And you can see how many more people become infected from an airborne virus than those that are passed through respiratory droplets. So what the chart is on the right-hand side of the screen, let me see if I can use my mouse. R0 is a way to estimate how many people one sick person is likely to infect. You can see for SARS-CoV-2, this is around 2 to 3.11 people, where if you look at an airborne virus, that number jumps up to anywhere around 11 to 18 or more, depending on the pathogen we're talking about. The rest of these are spread through vectors like Zika, 3 to 6.6. Ebola is spread through bodily fluids, so you have to actually make contact with blood or other secretions, and you can see the R naught is very low. So this is not technically an airborne virus, and I did want to emphasize that. However, we do know that it is spreading easily and sustainably in communities, and this is called community spread. What that refers to is the fact that often when this jumps into a community and starts to spread through a group of people, scientists have a hard time tracking down exactly where it started. So with that, I'll jump into the meat of the presentation. What should you do if you or someone you're caring for or someone that's living in your home exhibits some of these symptoms? So this is a slide with a lot of text. You don't have to read everything, but there are a lot of steps that you can take. First of all, if you are exhibiting symptoms, it's very important that you stay home and take care of yourself. Make sure if you go to visit a doctor that you call before seeking medical care, unless it is an emergency and you need to visit the ER. Try to avoid public transportation. Separate yourself from others, and if you can, stay in a specific room. And if you are caring for someone that you think might have the virus, it is important to ask that they stay in one specific room as much as possible. Wearing a mask does help. Monitoring symptoms and following any care instructions from a medical provider is crucial. If you do or a loved one does develop serious symptoms, it is important to seek emergency care. Just make sure that you're putting on a mask before that care arrives. If for some reason the person you're caring for, you cannot wear a cloth mask, so if you already have trouble breathing and putting on a mask is difficult, just make sure that they are covering all coughs and sneezes. The way that they recommend is putting your elbow up to your nose and sneezing into the crook of your elbow. All items should be thrown away in a lined trash can, and those need to be turned over and disposed of as frequently as possible. I think everyone's been emphasizing washing with soap and water, washing your hands for 20 seconds. That is so much more effective than using hand sanitizer, just for the record. Soap and water is fine. You do not need hand sanitizer. If hand sanitizer is all you have, obviously that's fine to go ahead and use, but if you can, do soap and water for at least 20 seconds. It also does not matter if the water is warm or cold. It's going to be equally effective either way. That's another question I've gotten. Try not to touch your eyes, nose, and mouth. Do not share dishes with anyone who might have had exposure to the virus. Make sure you're cleaning and disinfecting high-touch surfaces. So those would be, iPad screens, potentially, keyboards, mouses, monitors, remotes, any bedding. Just make sure those are getting disinfected often. And make sure that you're reading the instructions on your disinfectant of choice. So many disinfectants actually ask you to wait for the product to sit for X number of seconds, or in some cases, a few minutes before wiping it up. So if those instructions are on the product, make sure that you're following those directions for use. Caregivers can disinfect on an as-needed basis, but when they do, they need to wear a mask and use proper household disinfectants that are labeled to destroy viruses. Who is most at risk? For most people, the immediate risk of becoming very ill from this virus is thought to be low, but people who are older or someone of any age that has an underlying health condition, such as diabetes, lung disease, or heart disease, are at greater risk of severe illness. So they have started to note that there's a few more symptoms internally than just the virus affecting the lungs. So they've seen some kidney issues and some heart issues. So underlying issues with those organs can set someone up to being a little bit more susceptible to this virus. Based on the statistics now, males are more affected, and younger adults are also being hospitalized. They account for about 20% of hospitalizations, so they are still at risk, just not quite as much as those that are 70 and older. Obesity is starting to emerge as a potential risk factor for anyone over the age of 18. And then children appear to be much less prone to severe illness from this virus. Don't know why yet. People are still working on that. But just based on the statistics we have now, this is the information that I was able to find. And finally, are individuals with dementia at a higher risk of infection with SARS-CoV-2? In and of itself, Alzheimer's disease or any other form of dementia does not increase the risk of an infection, but increased age and some other health conditions that spur memory loss might pose other risks that we need to be aware of. For instance, people that are showing signs of dementia might forget to wash their hands or take some of those other necessary precautions that I mentioned a couple of slides ago. So caregivers can really help with that by offering reminders, writing notes and writing signs and putting them in high visibility places will help a lot, just to keep up with some of those cues that they might need. Washing hands before and after eating, washing hands before and after using the restroom, making sure trash cans are emptied frequently, that sort of thing. Additionally, there are some reports of mental health declines during this time just due to isolation and fewer visits from loved ones and family. So make sure that you and people you care for are checking in as much as possible with friends, family, social networks to have some support if you're feeling isolated or lonely, or if someone that you care for is feeling that way. Many people are recommending meditation and other relaxation techniques. So this is from an Alzheimer's Disease International group, and I thought this was really great. Trying to keep people in a routine is important. I know there are a few things that you might have to add to the routine that are different from day to day. I know I'm washing my hands a lot more frequently, but just keeping to that as much as possible while integrating these new precautionary measures. Encouraging people to call their friends and family via FaceTime or other virtual means is very important. For groceries, if they are not able to get groceries, it's important to just keep them on a set schedule, but also there are some things you can do with groceries to prevent bringing the virus into the household that I'll mention very briefly. Just washing fruits and vegetables, which you're supposed to do anyway. And if you are worried, throwing away the grocery bags as quickly as possible, washing your hands after unpacking, and you can wipe down boxes or plastic with Clorox wipes if you feel the need. It's not crucial. It's not likely you're going to pick up the virus from grocery runs, but if you're feeling uneasy, that is something you can do. Exercise is very important right now for building immunity. So keeping up with some sort of exercise routine, even if it's gentle, is great. And I'm sure Matt can hook you guys up with additional resources for those things. That's not something I have expertise in, but I do think it's very important. So with that, I can take any questions that people have, and that's it for me.
Awesome. And I think we do have at least one question here.
Okay.
So yeah, it is very difficult to purchase disinfectants right now. So does a homemade alcohol spray, so alcohol diluted with water, like a 3:1 ratio, would that work as well?
I have read that 60% and above solutions work just fine. I would have to do the math on that because it depends on what percent alcohol they started with. Mm-hmm. But if you get 60% or higher, that should be fine. Just be careful with alcohol and other really drying agents because those are obviously flammable and put people at risk of house fires. I've seen that in my field with bed bugs. People use those sprays as a bed bug treatment. Mm-hmm. And then things catch fire. So just be careful, but yes, those can work.
Yeah. Okay. Did we have any other questions? Okay, so that's the only question we had. But a lot of great information. Just to reiterate, the most important slide to us definitely is, like you said, dementia, in any of the forms or even mild cognitive impairments themselves aren't going to put your loved ones necessarily at more risk. But like Sydney said, diabetes and heart disease, which we all know are definitely very common for those who have dementia, that those are going to put your loved one maybe at a higher risk. And then obviously the age factor, since, our loved ones with dementia or mild cognitive impairments are definitely most likely going to be senior citizens. So definitely want to remember those things and take those extra precautions, and a lot of great information and tips that Sydney suggested. Of course, you can always go back and watch this video and pause on that slide if you want to take in that information again. And then also something else that we've talked about is the isolation, what that can be doing to mental health. And Sydney definitely touched that as well. But we all know that sometimes depression or severe anxiety or some of those mental health issues can actually start exhibiting symptoms that seem like dementia or mild cognitive impairments. So we really want to make sure that, especially our loved ones who we know already have dementia, or those that maybe at an age where that could be a stronger possibility, that we definitely want to spend some extra time calling them or FaceTiming or finding ways that may not be physically touching in with them, but just letting them know that we're still there, we still care about them, and seeing if there's any way that we can fulfill any needs. So if we don't have any more questions, just throw in a couple reminders. Again, remember that we're canceling in-person Lunch and Learn and support groups for May. We have all of our online May Lunch and Learn topics, dates, and speakers on the website. Our next one is going to be next Thursday, May 7th. That's going to be with myself and our grants manager, Amanda. We're going to be talking all about all of the caregiver grants that we have, how to apply, what that looks like, how to use the funds, and some suggestions as far as that goes. So we'd love for everyone to attend. Again, that's next Thursday, May 7th at noon with myself and our grants manager, Amanda. Again, if you are a caregiver whose employment or income has been impacted by COVID-19 in any way, please apply for our COVID-19 grant. We've had some amazing donors and foundations offer some gifts for that. So we have plenty of funds available for people to apply for and use that grant. And of course, all that information is on our website, alzark.org. But Sydney, thank you so much for talking with us today and being here, and we enjoyed it.
Thank you for having me. I appreciate it.
Yeah.
Thanks,
Bye.
Matt.